How do you know if your heart is healthy? And what symptoms might indicate a problem with your heart? Although heart diseases are often associated with genetic factors, this isn't always the case. In today's video, we'll look at 7 serious signs that may indicate a heart issue and the scientific basis behind them. Recognizing these symptoms early on is crucial, so make sure you watch the video until the end to avoid missing anything. After reviewing these 7 signs, we'll discuss additional symptoms that are often overlooked, but highly important. Finally, we'll cover essential tips for avoiding heart problems and maintaining heart health. Before we begin, don't forget to subscribe to our channel and like the video. Also, we need your valuable comments for YouTube to promote us. Feel free to share your thoughts in the comments section. If you are ready, let's get started. Section 1. 7 signs that may indicate heart problems. 1. Diagonal earlobe crease, Frank's sign. From this video onwards, I'm sure you'll start paying more attention to people's ears. But why? Because there may be a small sign on the ear indicating a blockage in the coronary arteries or carotid arteries. This was first reported in 1973 by Dr. Frank, who noticed that this ear crease was more common in individuals with coronary artery disease, which is why it's called Frank's sign. You may be wondering how the heart and ear are connected. One theory suggests that factors damaging the artery's inner walls could also cause this ear crease. Various studies have shown that individuals with Frank's sign are more likely to have coronary artery disease, hypertension, and diabetes. However, there is not enough evidence to use this sign as a diagnostic tool on its own. The crease can also appear due to aging-related factors like arterial hardening or reduced skin elasticity. The sign's accuracy is low. Only 40 out of 100 people with artery blockages show this crease, so even if you don't have it, you shouldn't feel too relieved. 2. Hair loss on legs. The primary cause of hair loss on the legs is usually a condition known as peripheral artery disease, PAD. Occurs when the arteries that supply blood to the legs narrow or become blocked, leading to insufficient blood flow. This poor circulation can affect the skin and hair follicles, leading to thinning skin, dryness, and eventually hair loss. This condition is also linked to the overall health of the arteries. Cardiovascular problems like coronary artery disease may be related to circulation issues caused by PAD. Therefore, hair loss on the legs could indicate a broader cardiovascular problem. Several studies have shown that leg hair loss, particularly in older individuals, can be an early sign of PAD and other cardiovascular diseases. 3. Xanthelasma, yellow plaques on eyelids. You may have noticed xanthelasma, yellowish, flat, or slightly raised deposits of fat around or on the eyelids. These are usually harmless and considered a cosmetic issue, but in some cases, xanthelasma can indicate cardiovascular disease risk factors. Xanthelasma often appears near the inner corners of the eyelids, caused by cholesterol deposits under the skin. It is more common in middle-aged women and can signal high cholesterol or triglyceride levels, which increase the risk of atherosclerosis, plaque buildup in arteries, and coronary artery disease. A popular study published in the British Medical Journal in 2011 explored the relationship between xanthelasma and cardiovascular diseases. 4. Arcus senilis, white or gray rings, around the cornea. Arcus senilis refers to white or gray rings that form around the cornea. It typically appears with age and is caused by lipid deposits. It's less common in younger people, but when present in individuals under 45, can signal severe dyslipidemia, extremely high cholesterol and triglycerides, and a higher risk of heart disease. If you're older and notice arcus senilis in your eyes, this is usually normal. Around 60% of individuals over 60 and almost all people over 80 have this condition, so there's no need to worry if you spot it after 60. 5. Cyanosis, bluish or purplish skin. Cyanosis, characterized by a bluish or purplish tint to the skin, mucous membranes, or nails, occurs when tissues don't receive enough oxygen. It often indicates serious heart or lung problems. Heart failure can prevent the heart from pumping enough oxygen-rich blood, leading to cyanosis. This condition may appear in individuals with chronic heart failure, particularly in cold weather or during physical exertion. A significant study published in The Lancet in 2018 examined the relationship between acute hypoxia, cyanosis, and various cardiovascular and pulmonary diseases. Warning: Article 6 contains images that may disturb sensitive people. If you don't want to see it, you can skip to Article 7 below. 6. Non-healing ulcers. Non-healing ulcers, particularly leg ulcers, can be closely linked to cardiovascular health. They often result from poor circulation, a condition connected to several heart and vascular disorders. For example, diabetic ulcers can also be linked to heart problems. Diabetes negatively impacts vascular health and raises the risk of heart disease. Persistent ulcers like diabetic foot sores may be a warning sign of underlying cardiovascular conditions. 7. Swelling in legs, ankles, and feet. Swelling in the legs, ankles, and feet, known as edema, can be a sign of heart problems. Such swelling results from fluid buildup, often due to heart failure, where the heart struggles to pump enough blood. Blood pools in lower extremities like the legs, causing swelling. Individuals with heart failure may notice their shoes tightening, ankles swelling, and indentations forming when pressing on the swollen areas. This type of swelling is commonly seen in the ankles and legs. Section 2. Overlooked signs of heart disease. 1. Shortness of breath. Shortness of breath can be a key sign of heart disease and is often caused by the heart's inability to pump blood effectively. When the heart weakens or arteries become blocked, oxygen-rich blood cannot reach the lungs, leading to difficulty breathing. Experiencing shortness of breath during physical activity or while lying down may signal heart issues. 2. Fatigue and weakness. Fatigue and weakness are common signs of heart disease and usually occur when the heart fails to function efficiently. When the heart struggles to pump oxygen-rich blood throughout the body, organs and tissues lack the necessary oxygen and nutrients, resulting in persistent tiredness and weakness. In cases of heart failure, weakened heart muscles lead to circulation issues and energy loss. 3. Nocturia. Nocturia, or frequently waking up to urinate during the night, may be linked to heart disease, particularly heart failure. In individuals with heart failure, excess fluid accumulated during the day returns as edema at night. This fluid shifts to the kidneys during sleep, causing an increased need to urinate. 4. Intermittent claudication. Intermittent claudication, or pain and cramping in the legs while walking, may be related to heart disease. This condition results from narrowing or blockage of leg arteries, which reduces oxygen supply to the muscles. Heart diseases, particularly conditions like atherosclerosis, affect vascular health and can also impact leg arteries. 5. Chest pain. Chest pain is a prominent sign of heart disease, often caused when the heart struggles to meet its oxygen and nutrient needs. Heart attacks or angina, chest pain, occur when the heart lacks oxygen, resulting in sharp, constricting or pressing pain in the chest. This pain typically worsens with exertion and may ease with rest, but can also persist during rest. It serves as a critical warning for those at risk of heart disease. Section 3. How to avoid heart problems. To avoid heart disease, adopting a healthy lifestyle is crucial. A balanced diet is key, meaning one rich in heart-friendly foods. Opt for whole grains, fruits, and vegetables high in fiber and healthy fats like those found in avocados and olive oil. Limiting red meat, processed foods, saturated fats, and trans fats can help lower bad cholesterol levels. Regular physical activity is essential for maintaining heart health. Aim for at least 150 minutes of moderate aerobic exercise or 75 minutes of intense exercise per week to strengthen the heart muscle and improve circulation. Exercise also aids in weight control and regulating blood pressure. Avoiding smoking and limiting alcohol intake significantly reduce heart disease risks. Smoking narrows blood vessels, hindering circulation and increasing heart attack risks, while excessive alcohol can damage heart muscles. Managing stress is vital for heart health. Techniques like meditation, deep breathing exercises, or hobbies can lower stress levels and benefit overall well-being. Getting enough sleep is another factor. 7 to 8 hours per night supports heart health. Regular medical checkups help detect risks early. Monitoring blood pressure, cholesterol levels, and overall heart health are important steps in preventing heart disease. These simple but effective habits can reduce heart disease risks and improve overall health. Your genetic background is also important. If you have a family history of heart disease, following these tips is even more crucial. If you've watched this far, don't forget to like the video and subscribe to the channel. You can also help your friends and family by sharing this video with them. See you in another video. Have a great day.